Hello, everyone. My name is Kiana Cole, and today I'm presenting my evidence-based practice project about how music therapy affects agitation and well-being in older adults with dementia. My PICO question focuses on older adults with dementia and examines whether structured music therapy, compared to no music therapy, can decrease agitation levels over an 8-week period. This question emerged from observing how common agitation is in dementia care and the need for non-pharmacologic interventions. Agitation affects up to 60% of long-term care residents with dementia. These behaviors can include restlessness, wandering, yelling, and aggression, creating challenges for nursing staff and reducing overall quality of life. Traditionally, agitation is managed with psychotropic medications, which carry risks such as falls, oversedation, and can increase mortality rates. Music therapy has emerged as a promising low-risk alternative. Research shows that music can decrease agitation, improve mood, and promote engagement. Because it is inexpensive, safe, and easy to implement, it aligns well with person-centered dementia care and allows nurses to use therapeutic approaches that reduce reliance on medications. My literature review included 5 peer-reviewed studies examining the impact of music therapy on agitation and behavioral symptoms in older adults. In the first study by Baker et al. 2022, they conducted the middle trial, which is one of the largest international cluster randomized studies on music therapy. While long-term agitation scores did not significantly differ between the groups, the study did show meaningful short-term improvements in mood, relaxation, and even social connection during these music sessions. This suggests that music therapy may have an immediate therapeutic benefit even when long-term changes are less pronounced. The NU ETAL 2024 study was a randomized controlled trial that used personalized playlists based on each resident's preferred music. This study found significant reductions in agitation as measured by the Cohen-Mansfield Agitation Inventory, along with decreased use of psychotropic medications. This provides strong level 1 evidence supporting individualized music therapy as an effective intervention. Yao et al. 2022 was a quasi-experimental study from Taiwan which showed structured group music therapy using singing, rhythm, and movement, resulted in notable reductions in both verbal and physical agitation. Participants also showed more positive emotions such as pleasure and alertness. This study highlights the effectiveness of culturally tailored group-based interventions. Lamb et al. 2022 provided a systemic review synthesizing 25 different studies. Across multiple countries, intervention styles, and sample sizes, the review consistently found that music therapy reduced agitation and depression while improving social engagement and emotional well-being. This broad body of evidence strengthens the overall reliability of music therapy as a non-pharmacological tool. Finally, Carmel et al. 2024 presented a rigorous randomized control trial study protocol focusing on individualized music therapy in Dutch nursing homes. Although it does not yet include outcome data, it demonstrates strong methodological planning, including blind assessments and standardized therapy procedures, adding confidence to future findings. Overall, this body of literature provides moderate to high quality evidence supporting structured and personalized music therapy as an effective intervention for reducing agitation and improving mood and enhancing well-being in residents with dementia. Across all 5 studies, the results were consistent and strongly aligned, reinforcing the clinical usefulness of music therapy in long-term care settings. Felicity Baker is a distinguished professor and one of the world's leading researchers in music therapy best known for directing the large-scale middle trial, one of the strongest studies examining music therapy in dementia care. Her expertise, publications, clinical expertise, and global research leadership makes her highly credible authority on how music intervention can improve behavioral and emotional outcomes for older adults with dementia. Patients with dementia often respond positively to music, especially when it is familiar or meaningful to them. Music can evoke memories, reduce anxiety, and create moments of connection. Many families express a preference for non-pharmacological approaches before turning to medication, making music therapy a patient-centered option. In conclusion, my review shows strong evidence that structured and personalized music therapy can significantly reduce agitation and improve well-being in older adults with dementia. Based on the research, I would recommend implementing a structured music therapy program within long-term care facilities, especially as a first line or adjacent intervention before using any psychotropic medications. These are references used throughout this presentation. All articles were published within the last 5 years, except for the Lamb Systemic Review, which was included for its comprehensive scope of methodological rigor.